When we spoke last year at the hearing, I mentioned the State of the Child report, and you had indicated that, a lot of those improvements were still in process, yet I continue to still hear about problems within the children and youth system that need fixed. And my question, though, pertains specifically to the budget request for 39 new positions within the children and youth offices, roughly about $4 million in funding, state and federal funding. So as I talk about some of the issues with children and youth and the horrific, heartbreaking stories that we continue to hear, I give a lot of credit to our county facilitators who are out on the street handling these issues. How are these positions going to help them?
So thank you for the question. And as you know, over the last year, focusing on vulnerable populations, including our children, and how we do a better job serving them has been a big issue. So the 39 staff that we're requesting for OCYF are requested so we can meet federal and state requirements and really to ensure child safety and well-being. These new staffers are going to be working on improving data and quality monitoring, establishing a statewide child welfare case management system, which I think is really important so our counties can connect to one another, and a lot of these families are transient, so I think that's a big issue. Ensuring timely child line and clearance processing, improving fiscal oversight of county budgets and coordinating with state priorities, and implementing and providing guidance on multiple federal and state system-changing pieces of legislation. So we look at sort of the workload over the last several years, particularly since changes with the CPSL, and that's really one of the major reasons we need additional staff. Since the CPSL changes to expand the individuals required to obtain clearances, for example, we received about 1.5 million child abuse clearance applications in 2015. That was up by about 162% from 2014, prior to the law changes. And this is also the cohort that is due to renew their clearances in 2020, and we are expecting about 500,000 more clearances in 2020 than in 2019. So that's one of the pieces of workload. Calls to Childline have continued to increase since 2014, an increase of 30,000 calls in 2019 comparatively. So in 2019, there was an average of 262 hours of overtime worked per week at Childline. So that was a total of over 4,300 hours of overtime worked by our caseworkers and our supervisors just from January to March of 2019. So this, of course, results in high turnover and inability to maintain Childline staffings just at complement. And, of course, our dropped and abandoned rate of calls goes up during that time as well. In 2019, we also had approximately 2,000 child abuse appeal requests received, which was a 12% increase from 2014. And there are over 10,000 minor perpetrator records that are currently on file that should be expunged and require information collection and review. And finally, in 2019, OCYF regional staff reviewed 278 reports of suspected child abuse fatalities and near fatalities, which was a 78% increase since 2014. So there's just a lot more work on this group of staff, and we need to be doing a better job, as we all know.
Okay. A follow-up question, and I think it sort of builds on what you're saying there. I'm new to the Children and Youth Committee, so I want to dig right in and do what we can to help fix the problems that I mentioned earlier. And as we started to go down that path, it was brought to my attention that on October 1st, Pennsylvania will opt into the Family First Prevention Service Act, yet I don't see anything mentioned in the budget or anything along the lines of what kind of funding might be needed. And as we talk about supplementals and overspending, based on unexpected needs, will there be a cost to implement this? And if you have time, expound on what these changes will do to provide better services for children and youth.
Do you want to talk about the budget, please? Is that incorporated in the budget? Okay. So I'll talk first. I'll let Dennis take the question about the budget. But right now, we are planning to implement Family First in October of this year. We may end up delaying that. There's no issues if we end up delaying it, and we can sort of pick whenever we opt in, but we do know that when we opt in, it's going to come at a cost. So I think the idea behind Family First is something we absolutely agree with. If we can do more on the prevention side and try to prevent these issues from happening, you're right. I mean, these are heartbreaking stories. Every time I read our quarterly fatality and near fatality report, I have a 3-year-old. I literally sit in my office and prepare myself because I will start crying, usually about the first one or two. They're awful. And part of what I think about when I read those stories is, how do we prevent these? How do we make sure this doesn't happen going forward? And frankly, one of the reasons we're expanding home visiting through the Medicaid program is because I truly think it's by getting to families earlier. When we looked at the data of infant fatalities and near fatalities in, I think it was 2017, 50% of those families were not known to child welfare. So our child welfare system isn't going to prevent those fatalities and near fatalities. So I think the idea behind Family First and trying to do more on the prevention side is a good thing. And we've been doing a lot to try to reduce our individuals in congregate care. And so, I mean, it's the right thing to do. I think it is going to have an impact on us because we do have a lot of folks in congregate care. Our OCYF is working very closely with the counties as we think about how we do more to build out opportunities for people to live in their communities and all of that. But it does take time to do that, which is why we delayed until this year and why, frankly, we may delay further because we know, like I say, it's going to have a budget impact. And so we want to delay that as long as possible and give ourselves more time to work with our counties to be ready.
The budget impact's what I'm concerned about now.
Yeah, it appears that we have about $16.8 million in Family First Transition Act dollars that we hope to receive in June. And then we'll be reevaluating that as we go along. And, if we need to increase the appropriation that's in, we'll certainly be back when we talk about the spring update to update those numbers.